Today we're going to talk about porcelain veneer, tooth preparation, maxillary anterior teeth. In this particular case, the teeth had worn the incisal edges, they were very translucent, very thin, the teeth were yellow, and the patient was just very unhappy with the appearance of her teeth. She's a TV personality, and it's very important to her that she have a gorgeous smile. So you can see the patient had Invisalign orthodontic trays when she presented in my office because of the large composite engagers. So she tried conservative things, bleaching, Invisalign, and couldn't attain the result that she was after, which was a light-colored, attractive tooth creating a beautiful smile. So after much discussion, we determined we would place porcelain veneers on the maxillary and mandibular anterior teeth. We're extending the porcelain veneers to the second bicuspid teeth in the maxilla. Step one is facial reduction with a coarse barrel diamond. I'm reducing the facial approximately 0.5 millimeter. Now, it's very important in the gingival fourth of the tooth that you not reduce a 0.5 millimeter, because the enamel in the gingival third or gingival fourth is only about 0.3 of a millimeter thick. So I'm barely going to reduce any enamel in the gingival third, even if that means once I seat the porcelain veneers, I have to come back and do a little fine polishing of that margin. And we'll fine polish that margin at the seat appointment with a very, very fine flame-shaped diamond burr with lots of water, high speed, followed by a 30 fluted carbide burr on a high-speed diamond with lots of water, and then 5 micron polishing paste. So back to the preps. A coarse barrel diamond is used to, number one, cut the teeth back into the proper arch alignment. If you have teeth that are crooked, there's a point you can restore them with veneers without orthodontics. Now, you don't want to overdo this, but if there's a little bit of crowding and a little bit of crookedness, you can cut the facial aspect of those teeth back into the arch alignment. I published an article on that in the Journal of Aesthetic Dentistry, and the reference is here. So we first cut the teeth back into the arch alignment, and you gauge that with a large occlusal mirror. Once the teeth are cut back into the proper arch alignment so that that's symmetrical, that's when the tooth preparation begins. That's when the 0.5 millimeter, 0.3 to 0.5 millimeter of tooth reduction takes place on the facial. And we're going to do that with a coarse barrel diamond burr. So I'm reducing 0.5 millimeter except for the gingival fourth. On the gingival 1/4, I'm only reducing the facial about 1 to 0.2 of a millimeter, which is just barely roughening the surface. And I'm going to extend the prep approximately 1 millimeter subgingival on the facial only. Interproximally, we're only going to extend that margin about 0.5 millimeter, because you want to be sure that you don't prep into the junctional epithelium, into the connective tissue. If you want to, you can place a small cord, a 0N Van R cord is a nice one to place on the facial to mark the apical aspect of the sulcus. I usually don't do that, but it's something I have done in the past. Once I've reduced the facial 0.5 millimeter from second bi to second bi, I'm going to come back with a fine flame-shaped diamond. And I'm going to make my interproximal cuts and my marginal preparation. Now, when you make this interproximal cut between the central incisors, it's critical that you sit the patient up in the chair so their face is parallel to your face. You want to be sure that you make that cut perpendicular to the pupillary line and in a straight line or parallel to a line down the center of the nose. Now, what if their midline is off? Don't worry about it. The studies have shown that a midline can be off 4 millimeters off to one side, and the average person won't notice that. The studies have shown that even dentists and orthodontists don't normally notice a midline being off until it's off more than 2 millimeters. So if patients are worried about that, don't get all hot and bothered. It's not a big deal. It certainly is not of consequence if the upper midline and the lower midline are not aligned. Hardly anybody's is. Do you know if yours are? I don't know if mine is. That doesn't make any difference at all, so don't worry about that. It's very important that you include the interproximal surfaces and the incisal surfaces in the preparation. Refer to the studies by Monnier and Douglas several years ago showing that veneers that include the interproximal and the incisal surfaces of the teeth are much stronger, durable, and aesthetic than those that just cover the facial. Now, some of you will say, oh my gosh, I hate to reduce that much tooth structure. Listen, we're committed. We're committed. Once you touch the burr to the tooth, once you put the veneer on the tooth, there's no going back. So make it as good as you can make it the first time. What if you don't include the interproximal? You ever seen people that drink a lot of coffee that have that little dark line right in the interproximal part of the teeth? That's going to happen with those veneers at the veneer tooth interface if you have that interface in the interproximal contact. The second reason is you never have to worry about interproximal decay again because it's covered with porcelain. They could get some decay on the palatal surface, but they can't get decay in the interproximal because that surface is covered with porcelain. Third thing, if you have dark teeth, like tetracycline stained teeth, and you don't include the interproximal mark contacts, you can get dark shine through from the dark teeth. So for those reasons, you always want to include those interproximal surfaces. It's called wrapping. Same thing with the incisal. As I'm going to show as I'm prepping these teeth, you want the incisal preparation to be flat, not a taco shell. You want it to be flat. You want the line angle, the palatal incisal line angle to be 90 degrees, not tacoed or beveled onto the palatal surface. These are the strongest margins. Trust me. I'll show you how to do that in a minute. So I'm cutting in the interproximal area between the two central incisors, and that's the critical cut. You want to be sure that cut is perpendicular to the pupillary line and parallel to a line down the nose. But remember, it doesn't have to be in the same line as a line down the nose. If the midline is off, cut through the midline and make that parallel to the line down the nose. Don't try to move it over and make it in line with the line down the nose, or you'll reduce tooth structure and end up with a really strange looking final restoration. So don't do that. Then when you cut between the other teeth, it doesn't have to be so parallel. It's not that critical. Now note, I'm only cutting between the teeth back to the cuspid and lateral incisor. I want to say that again. I'm only cutting, making complete interproximal cuts back to the cut between the lateral incisor and the cuspid, right and left. I'm not, repeat, not cutting between the interproximal contacts between the cuspids and bicuspids or between bicuspid and bicuspid. There's a reason for that. If you cut between the bicuspids, there's a wing or an arm on the veneer extending into the interproximal cut that can fracture. As you do more veneers, you'll know what I'm talking about. Just take my word for it. Don't extend the interproximal cut through the contact between cuspid and bicuspid or between the two bicuspids. That cut, that part of the preparation is only going to extend halfway through the interproximal contact. Now I'm using the fine flame-shaped diamond for my marginal preparation. Now remember, in the gingival preparation, marginal preparation, I'm only roughening the enamel. I'm not extending that preparation 0.5 millimeter into the tooth. If I do, I'm going to be indenting. What if you extend the preparation into dentin? Sometimes it's going to happen. You may have erosion. You may have a class 5 restoration, and you're in the dentin. It's not going to happen that much in the facial, in the body of the tooth, because that enamel may be, over 1 millimeter thick. So you're not going to, most of the time, you're not going to extend into dentin in the body of the tooth. What if the margins are in dentin? All the studies show the longevity and the stability of a margin in dentin is not as strong as a margin in enamel. This is one of those things, if you were prepping teeth on your wife or your daughters, you would want to try to keep it in enamel just because they're more durable margins. Read the studies and you'll understand that. But if it has to extend into dentin, then it just has to extend into dentin. What if you've got a class 5 composite on the tooth or a class 5 defect? Prepare it. You may even place a very filled composite in that defect before prepping the teeth. I'm using my fine chamfer diamond, and I'm extending between the teeth interproximally, and then I'm prepping my margins. My margins interproximally are only about 0.5 millimeter subgingival. On the facial, I'll extend 1 millimeter. The key point again is you don't want to extend the margins into the junctional epithelium or into the connective tissue. You don't want to go past the apical part of the sulcus. You may want to place a small white 0-end cord. I use Veneer in the facial sulcus just to mark the bottom of the sulcus to ensure you don't prep past the floor or the connecting part of the sulcus, where the sulcus connects to the tooth, into that junctional epithelium. I'm going to come back with that round-ended diamond, and I'm going to round all the line angles. Now, we're going to prep the incisal parts of the tooth. What if you've got one central that's broken and it's only about half a tooth? Are you going to reduce the adjacent incisor to that broken part? No, don't do that. Don't do that. Prep it ideally and just leave the broken one prepped where it is. But I'm going to sit the patient up when I'm prepping the incisal aspect of the teeth so that their face is parallel to my face and their pupillary line is parallel to the floor. And with retractors, I'm going to reduce that incisal edge with an occlusal reduction burr, and note how it's flat. How much do you want to reduce it? Well, you'd like 1.5 millimeters of porcelain. So does that mean you reduce all incisal edges 1.5 millimeters? No, not at all. What if somebody's ground their teeth away and their teeth are only 8 or 9 millimeters long? Well, the average central is 11 millimeters. And remember, you determine the length of the teeth, of the incisor teeth, a couple of different ways. If somebody has a flat lip, then you want some tooth display with lips in repose, like this. Have them lick their lip and hang. Let their lips hang. Just say, And you should always see some tooth display with lips in repose. I published an article on lips in relation to incisal edges a few years ago. The reference is here on the screen. you've got basically three types of lips: a flat lip, a moderately arched lip, and a maximally arched lip. The lip types are determined by lips in repose, not smiling. If a patient has a flat lip, it looks flat in repose, and you can use those lips to determine teeth length because you want some tooth display. If a patient has a moderately arched lip, that means when she just lets her lip hang in repose like this, half a tooth will be displayed. A maximally arched lip, in a maximally arched lip, when the patient just lets her lip hang, the entire tooth is displayed. You can see the entire tooth when she just relaxes her lips. So when she smiles, the corners of the mouth and the lip only extend coronally about 2 millimeters. If somebody has a flat lip, when they smile, it may extend up to 7 millimeters. We'll talk about that in a future video. So in this case, and when she has lips in repose, there is tooth display. So the teeth length is going to be within a 0.5 millimeter of the presenting length. So I am going to reduce the incisal edges of the anterior teeth 1.5 millimeters. That's the ideal porcelain length. Now, if you have longer than that, up to 4 millimeters cantilevered off the incisal edge will work in cases that the patient is not a severe bruxer or clincher. The more porcelain extended off the incisal edge of the tooth, the greater the chance of fracture. So 1.5 millimeters is perfect. So you can see how I'm prepping these incisal edges flat, but the preparation is parallel to the pupillary line, and I'm not extending it or tacoing it onto the palate. It's flat. I know that's hard for you to do because you want to put a bevel or a chamfer on it on the palatal side. Don't do that. Read the studies. Then I'm going to come back and round all the line angles except for the palatal incisal line angle. Leave that one right angle. But on the facial, on the incisal facial, on the interproximal, I want the prep of the tooth when viewed from the incisal to look like the shell of an armadillo. Do you people know what an armadillo is? Look it up. It's rounded, and that's the perfect preparation look of a veneer prep. Should be rounded just like the shell of an armadillo. Now, we're extending the preps back to the bicuspids. Between the cuspid and the bicuspid, remember, we're only going to extend halfway into the interproximal, just halfway into the interproximal contact. Then you're going to do the same marginal prep, about 1 millimeter, just roughening that enamel at the gingiva and extending about 1 millimeter into the gingival sulcus. Here's a part that really enhances the bicuspid prep. You're going to use a small round diamond and cut a lug into the incisal facial aspect of the prep. This does a couple of things. Number one, it thickens the occlusal margin of the bicuspid veneer. And the other thing, when you're seating the veneer, you have a stop. That's another good reason to include the interproximal and the incisal aspect of the teeth when you're prepping for veneers. So when you seat the veneer, it stops. If you only prep the facial surface of a tooth and you're trying to seat a veneer, I don't know if you've ever done that, but they swim. And it's nearly impossible to get them on the tooth right. This way, it just clinks into place. So in the bicuspid teeth, there's nothing to stop the veneer when you seat it because you're not including the occlusal surface. So cut this lug into the incisal facial surface of the tooth, and that will give you a stop and also make the veneer stronger. So here we have it. Porcelain veneer preparations on maxillary anterior teeth extending to the second bicuspids. In future presentations, we're going to talk about the critical techniques for veneer fabrication and seating of veneers so that you have gorgeous, lifelike restorations and super healthy gingival tissue.